Pain, pads and paracetamol. The time of the month is never fun. But for those with endometriosis, it can be unbearable.
I get an immense amount of pelvic pain on my first 2 days of my period, so I have to take lots of rest breaks. I have to stay in bed for pretty much of the day. I have to work from home. I've missed so many engagements. I remember missing my nephew's funeral. I've missed dinners, theatre trips. I wouldn't even count the amount of money I've lost over things that I've booked and not been able to attend. So it can be incredibly frustrating.
After 15 years of pain and frustration, Sanchia was finally diagnosed with endometriosis, a condition where tissue similar to the lining of the womb grows in other places. It's a disease that impacts around 1 in 10 women, but it's often dismissed, ignored and belittled. And a new study shows that in all 4 nations, diagnosis time has increased by almost a year since the pandemic. In England and Scotland, it now takes 8 years and 10 months to be diagnosed. In Northern Ireland, it's 9 years and 5 months. In Wales, it takes almost a decade on average. Nearly half of women surveyed say they visited their GP 10 or more times before actually being diagnosed, a staggering figure which causes concern as delay in treatment may lead to the disease progressing. And it's an unforgivable reality for charity Endometriosis UK, which is urging the government to act.
We want this to be a real wake-up call for governments and the NHS, and what we'd like to see is commitment from the NHS and governments in each nation in the UK to have a target of average diagnosis time of a year or less by 2030. We believe that's doable.
In a statement, the Minister for Women's Health Strategy said, "We are rolling out our women's health hubs across the country to support more women with specialist care required with this condition." But Sanchia says the fact that women are still waiting in pain is unforgivable and shows that there's still a very long way to go. Shaaman Freeman-Powell, Sky News.